welcome to Review Ready, Navigating Systematic and Rapid Reviews. This class was developed by Lewis Library Education, Research, and Engagement team. Today, we'll explore their key differences, methodologies, and tools that will help you conduct these reviews. By the end of this session, you should feel comfortable selecting the appropriate review type and synthesizing evidence with different tools. This pyramid illustrates the hierarchy of evidence commonly used in research. At the top, you have meta-analysis and systematic reviews, which synthesize existing studies and provide the highest level of evidence. Below that are experimental studies like randomized control trials, or RCTs, followed by observational studies, and so on. Rapid reviews sit just below systematic reviews, providing quicker but not as detailed information. Now, what is a systematic review? A systematic review is a structured, comprehensive synthesis of the best available evidence. It involves a clear research question, extensive searches across multiple databases, and strict inclusion and exclusion criteria. The goal is to evaluate and summarize the evidence in a way that minimizes bias and increases reproducibility. It's the gold standard for evidence-based practice because it considers all relevant studies on a topic. On the other hand, a rapid review is a less detailed version of a systematic review designed to be faster and less detailed. While it utilizes many of the same methods, it typically has fewer databases, limited inclusion criteria, and often little to no data synthesis. Rapid reviews are most useful when there is an urgent demand for evidence that will inform policy development or clinical practice, but this comes at a cost of rigor and completeness. It's important to know that team size matters. Whether you're conducting a systematic or rapid review, it's essential to work as a team. Systematic reviews, due to their complexity and time commitment, require 3 people, 2 screeners, and 1 expert in search methodology. Rapid reviews, while less intensive, still benefit from multiple team members to minimize bias. Don't attempt to review alone. Bias can creep in, and the workload is too heavy for one person. Let's address some common misconceptions about systematic reviews. First, systematic reviews are not the same as narrative literature reviews. Systematic reviews are structured, methodological, and comprehensive. Second, they are not limited to specific study types. They can include randomized trials, cohort studies, qualitative research, and so on. Finally, systematic reviews are time-consuming. They are not quick. The extensive process of searching, screening, and data synthesis make them a time-consuming project. Here is a quick comparison between systematic and rapid reviews. Systematic reviews are comprehensive, reproducible, and provide high rigor, but at the same time, they're work-intensive. Rapid reviews are faster, less comprehensive, and are useful for timely decision-making, but can be lacking in the same depth or rigor. Both have their strengths, and it's up to you to decide based on the purpose of the review and the urgency of the question. Before diving into the review itself, there are some necessary tasks that need to be accomplished. First, you have to have an idea in mind. Determine what it is that you're wanting to accomplish. Second, assemble your team. Include subject experts, librarians, and statisticians as needed. It's also crucial to conduct preliminary research to determine if a review is already underway and ensure you get buy-in from potential stakeholders. Step 1 in the review process is planning. It starts with formulating a clear research question and assembling your review team. For systematic reviews, you'll need a content expert, a librarian for comprehensive searching, and often a statistician can help analyze the data. For rapid reviews, your team may be smaller but should still include these essential roles. Planning includes defining your scope and objectives so that everyone on the team is aligned. It's important to define the question using research frameworks. Here's an example for systematic and rapid reviews. In Step 2, you'll develop a protocol that outlines your methodology. For systematic reviews, this protocol must follow PRISMA P guidelines and should ideally be registered in platforms like Prospero. The protocol should include your eligibility criteria, search strategy, and methodology. For rapid reviews, the protocol may be less formal, but it's still important to define how you'll conduct the review and what parameters you'll use. The PRISMA flow diagram is an essential component of every systematic review. PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis, and it is a widely adopted framework for reporting systematic reviews. The flow diagram is a visual tool used to track and document the review process. It's especially important for screening and inclusion of studies. This diagram visually represents the number of studies found during the search, the number of research that was disqualified due to title and abstract screening, and the reasoning behind it, the number of studies that were included or excluded after undergoing full-text screening, and the total number of studies considered for analysis in the review. Step 3 involves searching and managing evidence. Systematic reviews require comprehensive searching across multiple databases like PubMed, Cochrane, and Embase. In order to find studies that may not be published in peer-reviewed journals, you will also need to search gray literature. Gray literature are works that are not published in scholarly journals. Rapid reviews, on the other hand, may focus on fewer databases and exclude gray literature to speed up the process. Managing this evidence involves exporting citations and using tools like Covidence for efficient screening. One of the most important steps in conducting a systematic review is searching databases. This is how we gather all relevant studies on a given topic. Finding all research, whether or not they are traditionally published, is the aim of a thorough search and reduces the possibility of publication bias. Step 4 involves evaluating the study's quality using assessment tools and screening them for eligibility. To guarantee accuracy, dual independent screening is necessary for systematic reviews at the title, abstract, and full-text stages. Additionally, you will need to use techniques such as AmStar2 or Cochrane ROB to evaluate each study for bias risk. This procedure may be streamlined in a rapid review to expedite the results, but it is still essential to record exclusions and potential biases. Evaluating the caliber of the studies you include is essential when performing rapid or systematic reviews. This guarantees that your conclusions are supported by solid data. Structured checklists, or recommendations known as critical appraisal tools, assist researchers in assessing a study's methodology, potential for bias, and how it relates back to the research topic. This table on screen lists 5 distinct tools and their purpose. Step 5 focuses on data extraction and synthesis. In systematic reviews, you'll extract relevant data from each study and synthesize the findings, often using meta-analysis for statistical integration. Rapid reviews might focus more on narrative synthesis without the in-depth statistical analysis. In any case, you must evaluate publication bias and synthesize results to address the research issue. Now, let's talk about meta-analysis. Meta-analysis is a key tool often paired with systematic reviews. A meta-analysis is a statistical method used to combine results from multiple studies on the same research question. By combining data from several research studies, the goal is to provide a more accurate assessment of the impacts of a variable or intervention. When individual studies may have limited sample sizes or inconsistent outcomes, this procedure is especially effective. For example, if several small trials investigate the impact of a drug on hypertension, a meta-analysis would combine these studies' results to produce a single, more reliable estimate of a drug's effectiveness. It's considered one of the highest levels of evidence because it synthesizes data to find overall trends and can reveal patterns that individual studies might miss. However, it requires careful selection of studies to avoid publication bias, and the studies included need to be reviewed for similarity and ensure valid results. Finally, in Step 6, you'll report and disseminate your findings. For systematic reviews, follow the PRISMA guidelines to report every aspect of your research clearly. This includes tables, figures, and flow diagrams. Rapid reviews may have a more streamlined report, but it's still critical to disclose your methods, findings, and limitations. Your findings may be published in journals, presented to stakeholders, or used to inform policy decisions. After you've completed your systematic or rapid reviews, the next step is reporting and disseminating your findings. If you have any questions on the publication process or need help finding the right journal, be sure to reach out to your librarian. Systematic and rapid reviews are considered one of the highest forms of evidence, so it's crucial that they are conducted with the utmost integrity and transparency. Ethical issues should be the forefront of any review process to ensure that the review is reliable, reproducible, and free from any conflicts of interest. Be sure to have conflict of interest disclosures for each team member, register your protocol, and have strategies in place to reduce bias. Covidence is a web-based platform that simplifies the systematic review process by allowing team members to collaborate on screening articles, extracting data, and assessing risk of bias. Access to Covidence is limited, so be sure to reach out to your librarian for access. Besides Covidence, there are several other key tools for these reviews. JBI provides a suite of evidence-based practice tools for systematic reviews. JBI tools are useful for data extraction, critical appraisal, and quality assessment, particularly in the context of qualitative research and mixed method reviews. EndNote is a reference management tool provided by Lewis Library. It helps you collect, organize, and format citations in full-text articles. It is an essential tool for managing the large number of references you'll encounter during your reviews. LibKey Nomad is a browser extension that provides one-click access to full-text articles from PubMed, Google Scholar, and many other databases. It can save you time and improve access to full-text articles during this process. Libraries and librarians play a crucial role in the success of your systematic or rapid review. At this time, librarians cannot conduct systematic or rapid reviews with you, but we have other ways of assisting. Librarians can help with your review overview, resource instruction, and systematic searching. Contact your HSC librarian if you have any issues conducting systematic or rapid reviews. Use the contact information on screen, and remember, we're always happy to help. Thank you so much for joining me today on this session on navigating systematic and rapid reviews.